What time did Dr. Imad finish the lecture? Taqriban, what was the time? 10:30. So you had a break of half an hour, right? You are fresh now? Alright. Because we'll have 1 hour session of physiology, but then I'll give you another break, because without break it will be very exhausting, okay, if you keep on listening. So you need again a break, and then we'll restart, okay? But the break will not be very long. I'll give you half an hour break, not 1 o'clock. Before 1 o'clock I'll restart, inshallah. Is that all right? Okay. Yeah. So I think others will join us. If we wait, it will be very late. I'm starting the lecture right now. Okay. Where we stopped, if you remember, it was pulmonary ventilation. And I was telling you about the anatomy of the respiratory tract, that out of the 25 divisions, the first 16 divisions, taqriban, okay, 16, 17 divisions, they are only passing the air, okay, air is going down and down and down, and the air is coming up and up and up like this. No exchange, no movement of the air outside or inside, okay. But these are the pipes or the passages for the air conduction, okay. So the first 16, 17 divisions, yani from nose up to the level of terminal bronchioles, from nose to terminal bronchioles, these are the conducting passages or the conducting pathway, okay. No exchange of air here and there. After that, you have respiratory bronchiole, alveolar duct, and atria, alveolar sacs, and alveoli. Yes. From the respiratory bronchioles, badaya of exchange, the beginning of exchange is that area. As you go down and down into the alveoli, the exchange becomes best actually. But in the beginning, in the respiratory bronchiole, little exchange has started. Then you go into the alveolar ducts, better. Then you go into atria, even better. When you go into the alveolar sacs and alveoli, it is the best one. So the best area of exchange of gases is your alveolar sacs and alveoli, okay. The lower 6 or 7 divisions, the lower 7 divisions, last akhir 7 divisions are for the gas exchange, and you call it gas exchange area. So the first 16 or 17 conducting passage, and the last part is gas exchange area, okay. Now Shabab, a very important concept is coming up. We are having a continuous tanaffus. It's a continuous process, it never stops. We can stop it if we want, for a few seconds only. If I want you to stop, I say please stop your respiration, you will stop it, but not for a very long time. For a few seconds or for a little while you can do that, okay. But imagine, hawa is mawjood outside, alright, air is there. This air is also mawjood in our system, and it's mawjood in our nose and mouth, it is mawjood in your pharynx and your larynx and trachea and downer divisions of your respiratory system. So what do you think? Is there a continuous column of the air mawjood, or you think it's broken column? It's a continuous column, yani it's all air mawjood everywhere. You don't have any gap, you don't have any vacuum. Okay, you agree with that? So it's air mawjood. From alveoli to outside, air is in the continuous column. The only thing is that air is moving, it's coming here, it's going there, it's coming here like this, but it's a continuity, okay? The air from nose to the terminal bronchioles, air is mawjood. Any exchange of that air? No. That is called dead space. It's dead. Dead means no exchange. This area is called dead space. If I ask you what is the meaning of the word dead space, you say, come on, it's from nose to terminal bronchioles, that part of your system is called dead space, because there is no gas exchange. Very simple. After the dead space, akhir part is for the gas exchange. Air is also mawjood in that part. So what I'm trying to say is that some of the air is all the time موجود in your dead space. Do you agree? And some of the air is always موجود in your gas exchange area, in your lungs inside, alveoli and the atria and all those regions. And they are in continuity with each other. They are continuous. No gap. Now, when you're breathing, I'm starting a respiratory cycle. Now, what is the meaning of the word respiratory cycle first? I'm starting a new respiratory cycle. It means what? Inspiration. I'm beginning with inspiration. One inspiration and one expiration. That makes one cycle, Wajed cycle. Okay? How many cycles are there in 1 minute, taqriban, when we are at rest? Yeah, you can say that like from 12 to 16 or 12 to 18 cycles are there normally. We breathe 12 times or 14 times or 16 times. Mumkin a little different, but it's okay, it's normal. Right? This is your respiratory cycles or respiratory rate. Okay? When you are doing inspiration, air is already موجود in your pipes, isn't it? When you begin a new inspiratory cycle, what is happening? The jadid air is coming from outside. The new air is coming. Okay? What do you think? The air which is موجود already, what will happen to that air when you start a new cycle and you start taking the air from outside? What will happen to the air which is already موجود in your system, in your dead space? Some air is موجود in your dead space, isn't it? So what will happen to that air? That will go down. You are pushing that, isn't it? You are taking jadid air. Okay? When you are taking jadid air, it means now you are taking it inside and you are pushing your qadim air, which is موجود in your system, the dead space air, down. It will go into your alveoli area, your gas exchange area, isn't it? Okay. So you are taking some new air or the jadid air, and there is some qadim air or the old air which is موجود already in your system, isn't it? First, in your lungs, which air will move down? Jadid or qadim? Which one? Definitely. After that, jadid air will also move down into your system and it will go into your alveoli. Yani when you are having inspiration, two types of airs are going inside your alveoli. Awwal, it is the old air, right? Do you agree with that? And after that, some part of the new air will also go inside. Once you stop inspiration, like this, some part of your new air will stop in dead space also. Okay? Did you get the point? Some new air will stop in your dead space also. And this is your inspiration, khalas. You finished. Okay? So when you are inspiring, your alveoli are receiving how many types of airs? First, the old air which was موجود in the system, and the new air, jadid, which is coming from outside. Do you agree with that? Please come. Okay? And once you finish inspiration, once you stop inspiration, what is the situation of your dead space now? Jadid air or qadim air موجود here? Jadid. So did you get this combination in mind? Alright, okay. Now, you are expiring now. Okay? When you are expiring now, what will happen? Which column will move out first? The air which was موجود in the dead space, that was the jadid air which you took from outside. That will move first outside. Okay? And then from your alveoli, what will happen? Some air will come out and will go after that also. And at the end of expiration, when you are ending the expiration, last part, what will happen to your dead space now? Which air will be موجود in your dead space? The air which is jadid or the air which has come from the alveoli? What do you think? The alveolar air will now be موجود in your... Alright? Now you will start a new cycle and the situation will be repeated like this. So it's a movement of the column of the air when it is moving out or when it is moving inside. Did you get the concept? How the air is moving? What is your understanding of the already present air or the qadim air and movement of the jadid air which is coming from outside. You got the point? Okay? Yeah? Yeah, I'll repeat it again, but give me 1 second. Hello? Yes, Hassan, where are you? Right, Shabab? So let's resume. So you understood the meaning of different airs which are moving in the system. Okay, this concept is very important. Okay. Now you know I'm using the word jadid air and I'm using the word qadim air. When I'm using these words, you should understand what I mean by that. Now, I am going back to the definition which is called pulmonary ventilation. Please get the concept. Pulmonary ventilation. I'm repeating it first of all because you asked for the repetition. Okay. When I begin inspiration, all right, some air is already موجود in my system before inspiration. My dead space, air is موجود. Now I begin inspiration. Inspiration means I am taking air from outside. So when this air comes from outside, this is the jadid air. It will push the qadim air which is موجود in my system already. And that qadim air will first enter into my alveoli. After that, jadid air will go into my alveoli. And after that, last part of the jadid air will stop in my dead space. Okay? So awwal, qadim air, then jadid air going into the alveoli, and last part of the jadid air will stay in my dead space. Is it okay? When I start expiration outside, awwal, my dead space air, which was actually the jadid air which I took, okay, that will go out. After that, the alveolar air will go out. And after that, akhir part of the alveolar air will now stay in my dead space. Even after that, do you think some air is still موجود in my lungs? Yes or no? Yes. Always موجود in my lungs? Yes. And that is your residual air which is always موجود in your lungs, okay? Under normal conditions. You can't take all the air out of the lungs. Do we agree with that also? Are you clear about that? Okay. Now I am proceeding to the definition. It's pulmonary ventilation, Shabab. Okay. Pulmonary ventilation is the quantity of the air that you are taking into your lungs in wahid minute. The quantity of air moving into the lungs or out of the lungs. Take any one. Either you take inspiration or you take expiration. But in how much time? In wahid minute, please. In 1 minute. The amount or the quantity of air that you are taking inside into the lungs or outside of the lungs in 1 minute. Now the question is, when I'm saying amount of air which is moving into my lungs, all right, into my system, into my respiratory system, okay, I am going for, look at two things. If you want to calculate that how much air is moving into your system, you need two things. Awwal, you need, okay, how many times are you having respiration in your respiratory rate? One thing. And you will also wonder that once you are taking one inspiration, taqriban how much air is going into your system? How much volume of air is going? If you multiply the volume of air by the rate, you will get the total in 1 minute, isn't it? Very easy. Okay. So your tidal volume is your air 500 nus liter taqriban. It's 500 ml, which is moving in one breath, in one inspiration inside. Okay. And how many times are you respiring in 1 minute? You know, taqriban 12 or 14 or 15, like that. Here the example which is given is 12. The rate is 12 maktoob here. Do you see that? Okay. Usually we have the rate of 12 or 13. All right. And 500 means tidal volume in one breathing, in one breath. Multiply that. So how much is the total? It's sita. It's 6 liters or 6,000 mLs. Okay, 6 liters of air is moving in your system. All right. 500 from outside is going. How many times? 12 times it is going, so total air is 6 liters in 1 minute. Comfortable with this one? Now, this is pulmonary ventilation. You are saying how much of the outside air is going into your system, your respiratory system, okay? Now I'll change my word and I'll give you another thing. Now I say, no, I want khususan alveolar ventilation. What I want now? Not the pulmonary ventilation. I want to change it. I make it alveolar ventilation. Okay? If I say the word alveolar, it means I'm talking about how much air is going into my alveolar areas or the gas exchange areas. I'm not talking about the dead space now. I'm only talking about the alveolar areas. Okay? Will that be same like pulmonary ventilation? No, it should not be same like pulmonary ventilation. Okay? Now, I'll tell you. Our dead space from nose to our terminal bronchioles contains तकरीबन 150 ml, 150 ml. It is मौजूद तकरीबन average. It's 150. Okay, it's not fixed, but it's 150. Okay, so 150. Imagine it's a dead space volume. Now, if you are measuring the air which is going into your alveoli in 1 minute, you are talking about the jadid air which is going into your alveoli. Okay, how much of the jadid air how much of the jadid air is going into your system, not the alveoli only, the whole system? 500. But how much of the jadid air will be going into your alveoli? Yeah, minus 150. Remove 150 ml. 350 is going with each breath. All right? If I want alveolar ventilation in 1 minute, you will multiply 350 by 12, not 500. This time not khamsa miya, please. This time 500 is not the issue. This time it is 350. Why 350? Because 350 is the jadid air which is moving into your system. The definition of alveolar ventilation, now I'm giving you the definition. Alveolar ventilation. The amount of new air which is going into your lungs every minute. Okay? The previous definition of pulmonary ventilation was the amount of air which was going into your lungs in wahid minute. The second definition, alveolar, is amount of new air which is going into your lungs each minute. Is there a difference? Yeah, you understand the difference now? Because alveolar ventilation, yani jadid air you are talking about, multiplying jadid air by 12. And that will give you a value of 4,200 mumkin if you calculate. 4200, 4.2 liters takriban. Okay? Takriban, like this. If you multiply by 12. So, there is a difference between pulmonary ventilation, the total pulmonary ventilation, it is 6 liters in wahid minute. Okay? But if you are khususan talking about alveolar ventilation, then it is less. It is 4,200 ml. Am I clear about this concept? All of you, please? Okay? It's a very sensitive concept that you should know. How air is moving in your system, what is the relationship between the jadid air and the qadim air, and how do you differentiate alveolar ventilation from the pulmonary ventilation. Okay? That's good. I think I'm clear about the word alveolar ventilation. There is no need to stop here. I want to add one word here. What word should I add here? Thank you very much, so that there is no confusion. Now you are clear about it. Leave it as such. Okay, now it's not working for addition of the word, but you know the concept that we have to add one word here to make the definition very clear. so that you are not confused. The new air which is going into your alveoli or going into the gas exchange area, that is your alveolar ventilation. All right? But always when you're talking about alveolar ventilation or pulmonary ventilation, please, we are talking about the rate, and the rate is in time, and the time is taken 1 minute, per minute. We don't take per second, we don't take per hour, we always take per minute. In the respiratory calculations or the respiratory system, we talk about per minutes usually, okay? No confusion? All right. We are done with the alveolar and the pulmonary ventilation. Okay. Please stop me if you have any confusion of your concept. Okay. If you're not catching me, please stop me. Now, a very, very important concept which is coming up. Okay. You have done anatomy, mashallah. You are done with the anatomy of the respiratory system, lungs, the covering of the pleura also you have done. Okay. The thoracic cage also you have done. At least you have some idea about it. Okay. Good. So that will enhance your understanding. Lungs, elastic structures, they change the size, increase, decrease, increase because of the elasticity. Air is moving in, air is moving out. You know the system. Lungs are covered by a double layered membrane. You also know that. That's pleura. One layer of the pleura is attached to the surface of the lung, and from all sides really, except for the hilar portion and the hilum. Okay, it's all around the lungs. Okay, for example, you have a balloon, okay, filled with the air, balloon filled with the air. It's a soft balloon, and you take your hand like this and you put in that balloon your hand like this, isn't it? You are pressing and pressing that balloon, and that balloon is getting compressed. So one part of the balloon will touch your hand, and as your hand is going inside, this part will cover your hand. The other side or the other part of the balloon will be covering that part of balloon which is over your lungs, isn't it? So double layer is formed like this if you invaginate like this, isn't it? This is the example of the pleura. So lungs are actually invaginated inside, and they are forming a covering of double layered pleura. One layer is parietal and one is, and definitely the visceral layer is in contact with the lungs. Okay, visceral layer is kind of attached to the lung. Okay, there is an attachment. The visceral and parietal pleura are not attached to each other, please remember. Okay, they are touching each other like this, but they have a film of fluid, as if you have my hand and you put a little water on it, and you spread a water, and I put another hand on it. So only thing which is in between is a film of water. A very thin film of water, not really very much, only a thin film of water. So now it's like a zait, okay, and that gives lubrication. The pleura, two layers can move over each other like this, from side to side it can move, and from like this the movement can happen, okay. But this layer of water is acting like a magnetis also at the same time. It means two layers of the pleura you cannot separate it like this, because the layer of water is holding these two layers together, isn't it? Okay, so only a film of water. This is the pleural fluid that you have, a very little fluid. Don't imagine that you have a moderate amount of fluid or a big amount of fluid. Never. Under normal conditions, it's only a film for lubrication, like an oil. So this is the movement, okay. So two layers normally are inseparable. Inseparable means you cannot separate these two layers. If one layer is going in this direction, the other layer will go with this one. If one layer is going in this direction, the other layer will go with this one. So whatever is the direction of the movement, the two layers will go together with each other, not separated by any means normally in all of us. Okay, clear? Now, your parietal pleura, the outside one, the outer layer, the parietal pleura, is in contact with the thoracic cage. Okay, what is the tartib now? Lungs covered by the visceral pleura, visceral covered by the parietal pleura, parietal is covered by or in contact with the inner surface of the thoracic cage, and it has kind of an attachment with the inner side. All right, so this is the tartib of movement. Now, Shabab, If you are moving your thoracic cage with the help of your powerful muscles, if you are opening the thoracic cage, it means you are taking the parietal pleura with the thoracic cage, isn't it? When you are taking the parietal pleura, what will happen to the visceral pleura? It will go along with? Okay. When the visceral pleura is going along with the parietal pleura, what will happen to the lungs on which it is attached? You are stretching the lungs from outside. When you are stretching the lungs from outside, what are you doing with the size of the lungs? What are you doing with the size of the alveoli? Increase. What are you doing with the volume of the alveoli? Increased. If the volume of the alveoli is increasing, what will happen to the pressure of the alveoli? Decrease. Did you get this equation in sequence? Are you getting it? Well, you are stretching the lungs. If you are stretching the lungs, you are increasing the area. When you are increasing the area of the alveoli, you are decreasing the pressure which is موجود in the alveoli. Okay? Are you getting it? So please, during inspiration or during the movement of the thoracic cage like this outside, all the layers are moving in one direction. Okay? Thoracic cage along with the parietal and visceral pleura along with the external surface of the lung and stretching. Inside of the lung is stretched, the size of the lung is increased, and the alveolar volume increases also. Okay? Hold it right now. When you are relaxing your thoracic cage, you are bringing the thoracic cage back outside. Okay? From outside to inside. So when it is going back down, what is happening? You are actually compressing the lungs, isn't it? So when you are compressing the lungs or the lung size is decreasing, the visceral pleura is going towards the lungs all along with the lungs. The parietal pleura is moving along with the visceral. The thoracic cage is coming down to its original position. Is that clear? So what will happen? In this phase, expiration will happen. Alright? Inspiration, expiration. What I'm trying to say that all the things are moving as a unit. They are moving as a unit during inspiration and they're moving as a unit during expiration. Coming to a very important concept, please. All of you, very attentive, please be careful. I told you the two layers of pleura, you cannot separate them. Okay? If you want to remove these two layers away from each other or put them apart from each other, okay, you cannot do it normally. But if you are doing it like this, you're trying, and yet you are not separating, there is some pressure موجود in the pleural cavity. First of all, tell me, pleural cavity, is it a closed cavity or it has some communication with other systems of the body? What do you think? It's a closed cavity, okay? And it has some pressure also. And this pressure is said to be the negative pressure. Now, this is a question. What do you mean by negative pressure here? And how can you have a negative pressure in that closed cavity? This is a question. Okay? So negative pressure موجود all the time, okay, normally. Whether you are having inspiration or you are having expiration, your pleural pressure remains negative. It's a negative pressure. Now the question, sawal is, why do you have negative pressure? How is it possible? Who is making it negative? Why? Any idea? It's closed, okay. But it's not lazim. Any closed space can have some positive pressure also, isn't it? If I have this room closed completely, no outside communication, completely closed, okay? From there also, from all the spaces or the slits, if I close, still this room has some air موجود. Will this room has positive pressure or negative pressure at that time? Because air is موجود here, isn't it? But if I have a suction pump for the air, if I put one suction pump here and that suction pump is taking the air outside continuously, okay, and no new air is coming from inside and air is being taken from outside, after some time what kind of pressure will develop in this? Now it will become negative pressure really, because I am removing the air from this, okay. In the pleura there is no air, okay. In the pleura there is some fluid. and that fluid has the pressure, but that pressure is a negative pressure. You will say, fluid and negative pressure, it does not make sense really. But if some fluid is coming into the pleural cavity and that fluid is taken by the lymphatics, there are lymphatic drainage pumps موجود in the pleural space, and they are continuously taking the fluid out, they are not allowing the fluid to accumulate. Only a little amount of fluid is baki in the pleural cavity. If continuous suction is done by the lymphatic pumps, what kind of pressure do you expect to be created in the, it's a negative pressure. So now you know the reason why the pressure is negative inside the closed cavity like a pleura. Okay, you call it negative pressure. Now this negative pressure can change. These are the two layers of pleura. Some negative pressure is موجود in between. If you are, now please, logically, think logically. If I am pressing these two areas against each other, the type of pressure is a positive pressure or a negative pressure? Positive. But if I am trying to pull these two apart, then the pressure inside will become more negative, isn't it? So when I'm doing it like I'm pressurizing it and making it positive. But if I'm trying to do it like this, I'm trying to create more negative pressure. Is that okay? Okay. Now you think. In inspiration, when I'm inspiring, my muscles are opening the rib cage. My parietal pleura is trying to move along with the thoracic cage. And it is trying to get separated from the visceral pleura. So the pressure which is موجود is negative. Will it become more negative, same or less negative? Oh, very good. So during inspiration, because your parietal pleura is moving in this direction, so a new force is developing and your negative pressure becomes more negative. It was negative from before. Now it will become what? More negative. In expiration, when you are coming back in this position, what will happen to your intrapleural pressure? Will it become less negative, or will it become same, or will it become more negative? It becomes less negative from the inspiration value, less as compared to inspiration, and again it will come at the same level at the starting point as you started the inspiration. Okay, so now I'm telling you, normally at the beginning of inspiration, badaya of inspiration, your pleural pressure is -5. How much? -5. As you inspire, you expect that it will become more negative. So will it become -6, 7, or will it become -4 or -3? What do you think? -7.5. Yani from -5 you are moving to -7.5. You are decreasing, okay, the value, isn't it? And this becomes more negative, from less negative to more negative. During your expiration, when you are expiring, again your -7.5 will become at the nihaya of the expiration, it will again become -5. Yeah, and it's so easy. From -5 to -7.5, from -7.5 to -5, from -5 to -7.5, and again you are coming back. This is our normal process of inspiration and expiration. Am I clear about that? Okay. So now you've got the idea, pleural pressure, what is it? What kind of change happens in the pleural pressure under normal conditions when we are inspiring and expiring. Okay? All right. Shabab, I'll give you only a brief summary, okay? And I'll skip the slides because you can read it later, the same information we are discussing. You need only a concept. Your respiratory system, the thoracic cage, is supplied with wonderful muscles really, which are responsible for movements of the respiration, isn't it? You can see many muscles are موجود. Pectoralis muscles are موجود, and the intercostal muscles are موجود, and there is a very big muscle between the abdomen and thorax. It's diaphragm, isn't it? These are the major muscles which we talk about in respiration. Okay. They are separate muscles, okay? Some muscles are here in the neck, going sternocleidomastoid here, These are the intercostal muscles, rib muscles, external and intercostal muscles, and there are some muscles, pectoral muscles, they are also involved to some extent. Scaleni are also there, attached to the ribs, and finally the diaphragm is there, okay? We'll talk about these muscles, but conceptually, okay? Now, inspiration, expiration, two phases of breathing. When I say breathing, are you comfortable with the word breathing? Okay, or respiration? I'm saying there are two phases of breathing. Okay, inspiration, respiration, and expiration. There are two patterns of breathing normally that we have. One pattern is like now, we are all breathing, we are sitting, and we have no problem. Automatically it is going on. Inspiration, expiration, we are not even thinking about it. Whether we are awake, sleeping, talking, eating, or doing anything, okay, that process kind of continues really. It's a continuous process. At rest, this is called your respiration at rest, okay? And this is called normal, quiet breathing. What do you call it? Normal, quiet breathing, okay? So right now we are having normal, quiet breathing. It has two phases, inspiration and then expiration. Now, inspiration in this phase needs some muscles because your rib cage is moving. So inspiration is an active process or a passive process? Active. When I say active, I mean muscles, please. Active means involvement of muscles. So is it active or passive? Khalas, active, okay? After I inspire, then I expire. Is my expiration coming out passive or active? Passive. Because it does not require any new muscles. My muscles will relax, my cage will come back, and my diaphragm comes to the position. My lung, because of elasticity, will come back to its original position. So all the phenomena which are happening are passive in nature. Yani no muscle is needed in your expiration. In this condition, in this normal condition, quiet breathing, right? Now, I'm doing another type of breathing. I say, okay, I'm playing a game, Kuratul Qadam, or I'm playing any other game, tennis, or I'm running, okay? Or I'm doing some exercise. What happens to my breathing? Inspiration and expiration. Look at the pattern of inspiration. Inspiration. Is it same like normal quiet breathing? Is it active now, right now? More active. The word is more active. Yani more muscles are needed now. Okay? All right. What do you think about my expiration? Active. Now your expiration has become active also. Yani muscles are needed. Some muscles for expiration. Okay? So, how do you compare normal breathing and the forceful breathing? Inspiration and expiration, both are active in which type? Both are active in which type? Forceful. Inspiration is active in normal quiet breathing, but expiration is passive in normal quiet breathing. Is that okay? This is how you compare normal quiet breathing. Yeah. Normal quiet breathing. Inspiration, active. Expiration, passive. Forceful breathing. Inspiration, active, more active. Expiration, active. Got the words? Okay. Clear? Okay. Yani muscles are lazim. They are involved in both phases. Okay. Normal quiet breathing. Inspiration. Which muscle is the most important muscle in diaphragm? It's all about diaphragm. Taqriban 3/4 portion, 75-80% of the job is done by the diaphragm. A little job is done by the intercostal muscles, external intercostals. They are also helping to elevate the ribs. But the main is diaphragm going down and up, giving the space to the lungs. So diaphragm is the main muscle of your normal breathing. Okay? Intercostals, little addition. Okay. Expiration, no muscle needed. Relaxation. Forceful breathing now. Okay? More active. Diaphragm working? In this one, diaphragm, yes or no? Yes. Diaphragm is fully active, maximally active. But ma diaphragm, along with that, now you have more muscles. External intercostals working maximally, but still you need some more muscles really, okay, for inspiration. Now sternocleidomastoid and scalenii, these muscles will try to elevate the ribs more because you're working more now. So maximum effort is coming. So other groups now are involved. Your scalenii, your cleidomastoids, they are involved. And these muscles, extra muscles, are called accessory muscles. Now accessory muscles are starting. Okay? Khalas. Put your hands here. All of you. Okay? On both sides. You have the muscle known as sternocleidomastoid. Do you see that muscle? If you turn your neck, you can hold this muscle, this one, this longitudinal pillar-like muscle, this one, the main muscle coming in front. Okay? And this one is the second sternocleidomastoid. All right? So you are putting your hands on the cleidomastoid here, both. Okay? Now, keep breathing as you are breathing normally. Inspiration and expiration normally, without any effort, normally. Okay? Do you feel any special change in this sternocleidomastoid? No. Okay? Now, all of a sudden, all of you, take a very deep breath and feel sternocleidomastoid. Very deep breath. Like this. And feel it. Does it make any change in the muscle? Do you feel any tightness in the muscle or no? Okay? Or no? Please, if you are putting it and taking a deep breath like this, is it becoming contracted? Okay? Okay. So, what did you observe yourself? Sternocleidomastoid, is it involved in normal cord breathing? Is it involved in your forceful breathing for inspiration? Alright? Now put your hands here on the abdomen. Okay? Normally inspire and expire. Inspire normally and expire normally. You will see a slight movement of the abdomen only, that it's slightly moving out and slightly going. It's normal. Okay? But do you really feel contraction of the muscles of the abdomen? You don't feel anything, right? You don't feel. Except for a little movement of R. Now, you inspire normally. Take a deep breath, inspiration. Even in the deep breath, do you feel any change in these muscles? No. Except for the little movement. Do you really feel tightness of that muscle? No, you don't feel the tightness really. Okay, you feel that air is going inside your system, but not tightness of these muscles. Now you forcefully expire like this. Okay, blowing the air. Do you feel the tightness of these muscles when you are blowing the air? So it means your abdominals or your muscles are becoming tight in expiration, isn't it? With this simple demonstration, you can feel yourself that your expiration in forceful breathing is also active, and your abdominal muscles are required to compress the abdomen. Okay? When you are expiring forcefully, like this, okay, you will feel tightness in your muscles here. It means they are contracting and they are compressing against the diaphragm, and your lungs are compressed. Okay? So they are involved in forceful expiration. Okay? Your sternocleidomastoids are involved in forceful inspiration, and these muscles are involved in forceful expiration. That clear? Clear to all of you? Yes, dear.
What about pectoralis major?
About?
Pectoralis major.
Pectoralis major and minor, they have a very little role, and they have the role in the movements, but during inspiration they have a slight activity, not in the normal one really. Pectoralis major and minor both have some role, but not a very significant role in inspiration. Yeah?
But we studied in the anatomy.
Yeah?
It has a big role.
In what? In what?
Force.
No. In forced inspiration? Inspiration you are saying? No, it does not have a big role. It does have a role. Normally it does not have a role. In that case, it does have some role, but the main role here, again, goes for your sternocleidomastoids and intercostals, and still the diaphragm is maximally working. First you have this role, and then you have the role Shoya only for the other muscles really, okay? Not the big one. Clear about the muscles and the arrangement? Okay? Right, Shiva, please. Hold on. Now I am giving you a complete process A complete process which you will understand. Okay, that's very easy. Normally, okay, the air moves in and out according to a qanun of pressure, difference of the pressure. We know it from physics, basically, isn't it? From higher pressure side to the lower pressure side, you will have the movement. If you have equal pressure on both sides, will you have any net movement of something? No, never. Okay. Wherever you have the higher pressure, the air will move from that side to a lower pressure side. Okay. Same is the case with the fluid also. The movement from high pressure area to the low pressure area. In circulation, hemodynamics, you have done it. Okay. Now, respiratory cycle. Inspiration, expiration. I finish one. I'll start a Jadid one now. Inspiration and expiration. It's a cycle for about 5 seconds. Okay? Some part of it is inspiration and some part of it is expiration. Which part is longer, which part is shorter? We will see that. I'll show you a picture. You will decide yourself. Okay? But one process is active, one process is passive. You know that. Okay? When you are inspiring, no, before inspiring, you are beginning a new cycle, yani just beginning. At that time, your alveoli and your atmosphere, the pressure in the atmosphere is taken as 0. What do you call it? Sifr. Your pressure in the alveoli is also sifr. Now you are starting the cycle. You have just finished one cycle of respiration. At the end of that cycle, your pressure in the alveoli, alveolar pressure is 0. Your pressure outside is also 0. Will there be any movement? No. For a very fraction of a second, no movement. Now you begin a new cycle of inspiration, Jadid cycle of inspiration. Okay? Your thoracic cage is opening. Your parietal visceral pleura moving. Your lung is stretching. Your alveolar volume is increasing. What will happen to the pressure in the alveolus? From sifr, it was sifr. It will become -1 now during inspiration. -1. What is the pressure outside now? And what is the pressure inside now? Is there a difference in the pressure? So what will happen now? The air will move inside. This is the basic principle. Okay. So your muscles are doing the job. Your muscles are working. They are increasing the size of the alveoli. They are decreasing the pressure of the alveoli. And the air automatically moves from outside to inside. This process is called inspiration. Clear? At the end of inspiration, when you finish inspiration, before starting the expiration, okay? What do you think? The pressure at the end of inspiration. You inspire like this and you finish inspiration. Now the pressure, positive. If it's positive, then the air should be moving outside. You are holding yourself for a fraction of a second. At that time, what will be the pressure? When you are holding, 0 again. Okay, that's the point. Okay, so again from negative, it slightly becomes 0. Okay, so 0 again, 0 outside also. Now you begin expiration. When you begin expiration, this pressure of the alveolus will become now what? Positive. You are compressing it from outside. It becomes positive. Now here it is positive and outside it is? So what will happen now? Movement of the air outside, and that's okay. So the cycle changes. Alveolar cycle. At the beginning of your inspiration, you start from 0 and you become negative during inspiration. But at the nihaya of inspiration, again you touch a value of 0. And at the badaya of expiration, again you will become positive. And at again the nihaya of expiration, you will become. In this manner, your cycle is changing, and in this manner, your phases are controlled. Did you get that? Okay, great. So, inspiration, expiration, I told you about. All right? Your negative intrapleural pressure is controlling your alveolar pressure, because if your pleural pressure becomes more negative, in which phase it becomes more negative? Inspiration, -7.5, remember? Okay? When it becomes -7.5, it will stretch the visceral pleura more, okay? And the alveoli will become bigger in size, and the alveolar pressure drops. So when your pressure in the pleural space is -7.5, what is the pressure in your alveolar space or in the alveoli? -1. When your pressure in the pleural space again comes back to -5 value during expiration, what is the pressure in your alveolar space there? It becomes, no, I'm saying the pressure is becoming and it's going towards the -5. From -7.5 now it is going towards -5. The phase is expiration. So now what kind of pressure is موجود in your alveolar space? A positive pressure. تقريبا +1 would be موجود at that time. Okay? So it means the two pressures are going together. When you are having inspiration, your pleural pressure becomes towards -7.5 and your alveolar pressure becomes -1. When you are moving towards expiration, your pleural pressure becomes -5 and your alveolar pressure becomes +1, +1. In this way you have inspiration, expiration, inspiration, expiration. Am I clear about that? Okay. We are done with this. This is the movement you have done. You see this movement yourself, how ribs are going up and down. Okay, it's nothing. And the movements in anatomy also is given to you, the bucket handle and the pump handle movement. So nothing special. I'm not stopping. Okay, just have a look at the animation from the side. Now, a very important concept is coming up. How much time is this? 12? I'll take 5 minutes more. I'll stop here after 5 minutes and I'll give you a break. Okay? And then we'll resume the lecture after exactly half an hour. Is that okay? Okay. 5 minutes more. Just finish. Look at the movement. Your thoracic cage. Okay? This is the front aspect you are looking at. And this is the sideward aspect you are looking at. Or this is the side you are looking at here. Okay? This is your back aspect and this is your front. Okay? Now, think it as a cavity. It's a cavity. It's a very good cavity. Thoracic cavity. The size changes really. Okay? Now, it's not a completely round cavity, but it's kind of a cylindrical cavity you can see. From above it is a little narrow and from below it becomes broader. But it's kind of a cylindrical cavity, isn't it? We have got three diameters of this cavity. One diameter is, you're considering this one, vertical, okay? From above downward, vertical. Inside the cavity, you are considering this diameter, and this is vertical diameter, all right? Okay? One diameter of the cavity is this one. From anterior side to the posterior side, this one is anterior-posterior diameter. Okay? And one diameter is the lateral or the horizontal or the transverse diameter. This is the transverse, this is anterior-posterior, and this is one. Okay, yeah. Thoracic cavity changes itself in all three diameters. Okay? But diaphragm has the maximum movement. Diaphragm is going down and it's going up. So what kind of movements do you expect? Vertical diameter increasing and vertical diameter decreasing with the diaphragm. Okay? These are your ribs. When you are elevating your ribs and the cage, what is happening in your anterior-posterior diameter? And also the lateral diameter, both are changing. So your intercostal muscles and other muscles of respiration which are attached to the ribs, they are opening like this, okay? They're coming up and they're coming down. They're coming up. So both the diameters, this one and this one, they depend on the other muscles. But this diameter, the vertical one, it depends on, mainly on one, okay? It is the diaphragm. You have got the idea and you can see the movement and you can see the front also. It's moving when it is moving up and down from the front, okay? All right. Just after closing these slides, 3 or 4 slides, I will stop here and we'll continue later. Changing thoracic volume. Now you want to change the volume. Okay? You can increase the length, you can increase the circumference. Circumference you are increasing by these two diameters, and the length, the tool of the cavity, you are increasing by the diaphragm movements. Okay? All right. Look at this one. Have a look at this slide. That's a very good conceptual slide. You are changing the diaphragm. Okay? What is happening to the size of the cavity? This is the normal size of your cavity. Okay? Now, during inspiration, what happens to the size of the cavity here? Alright? This is normal inspiration. This is your normal size of the cavity. But if you are compressing your abdominal muscles for expiration, what will happen to the size of your cavity? Your diaphragm is pushed up against and your cavity will become. So the upper part of the diagram is giving you the normal breathing or the forceful breathing? Upper part of the diagram. Okay, normal breathing. Usually it's showing you the normal breathing, but okay, even in the forceful breathing, in inspiration it can change. Okay, this part of the diagram, abdominal muscles are contracting. What do you think? This phase, does it belong to forceful or? It's forceful. So upper one is used for resting as well as for the forceful also, because inspiration, diaphragm is moving in both cases. But this one, diaphragm is going up by the compression of the abdominal muscles and decreasing the size of the cavity like this. This is happening only in the forceful expiration. Did you get the diagram? Okay. Look at this one very quickly. Changing the circumference. Now you're changing the circumference. Okay. Which diameters are we using? Okay. All right. Okay. It's increasing in this direction. The lateral and also some contribution of the anterior posterior will come in it. Okay. So what is happening to your cavity size? It is becoming more in circumference when you are, yes, and when you are using your intercostal muscles mainly, isn't it? Okay. What is happening here? What is happening here in this way? If your internal intercostals are contracting, what do you think about the internal intercostal muscles? We haven't talked about these muscles. We talked about diaphragm, we talked about external intercostals, but we did not mention the word internal intercostals. What do they do? Sure. Force expiration, that's a good point. And what do they do actually? They depress, rib depressors. Externals are elevators and they are the depressors, but they are working only in forceful expiration when we are exerting. So when you are working on the internal intercostals, what change is happening in the size of the cavity? Do you see the size of the cavity? Yeah, okay. There is a change. This is your width of the normal cavity, and if they are working, what happens to the width of the cavity? Okay, decreased, this one. This becomes decreased. Okay. So did you get the concept of the intercostals and the diaphragm and the diameters which we are working on? Alright? This is all about which we have already discussed. -5, -7.5, the changes. Outside pressure, inside pressure. Now, it's all for you to look at the diagram and see what changes are happening in inspiration, expiration. I'll run the slides later also. And I'm stopping here. Okay? Have a break. We'll come back inshallah. Exactly what time is it now? Give me the time. Okay.